Hi, it's Dr. Gambhir. Hope you're doing well. Talking to you today as part of our facial analysis series. So we have a lovely patient here who's probably in her somewhere between her late 20s to late 30s. And first thing I say about all patients, because it's so true, she's absolutely beautiful. Every patient we see has uniqueness to their face, and that's what really makes us all so amazing and awesome. So the character points on her face could be the crow's feet that we're seeing, some of the freckles that we're seeing, her smile with slight gum showing. That really helps to define who she is. But those are also things that we can talk about if this patient has concerns or it's not making her feel happy internally. So as we start to look at this patient, we're going to look at her as a pillow. The pillow has two layers. It has a pillowcase, which gets wrinkles and stains. So we're going to talk about kind of washing and ironing that pillowcase. And then the second part of that pillow is the padding, and we can talk about whether strategically for this patient, adding padding into any area would be helpful for her through filler or collagen building. So if we're taking a look at her from a pillowcase standpoint, we can see on close-up that she has some kind of freckling, some dullness of the skin. And again, this is us being very critical. So doing some peels which are appropriate for her skin, perhaps VI peels, could be a good start to her, and maybe building up to laser peels if her skin can tolerate that. I think those peels would also help with over time with the fine lines and wrinkles around the eyes and throughout the face. But again, very minor stuff. If we take a look at her from a volume standpoint, her volume generally looks pretty good. So I don't think we need to add a lot more volume anywhere to the face. This picture is of her smiling. If she was in a neutral face, we could see maybe does she need a little bit more lift on the cheek? Does she need a little bit more lip volume? And none of this is needed. So sometimes this is just kind of playing as we play with our clothing. Do we want a little bit more of a fashion statement in this way or that way? And these kind of things that we do in the office can be used in our younger patients to create that personal fashion statement for them. Always keeping our eyes wide open that these are medical procedures and they have pros and cons that need to be discussed in there. I think over time, collagen building would be a great thing for her to kind of keep that volume up and not allow her collagen to fall too quickly and drop. So starting earliest in the late 20s, sometime usually in the mid 30s, collagen building procedures such as Thermage and Sculptra and others can be amazing. Going back to her pillowcase for a moment, but Botox can be used around the crow's feet for her to soften the crow's feet. Even if she loves her crow's feet, we don't want them to perhaps get too deep over time. So they can be used for softening, not necessarily elimination. Her forehead lines are mild right now. Again, preventative Botox can be done. The face does not need to be frozen. I think her gummy smile, which shows a little bit gum, is amazing. But if the patient is distressed by that in some way, there is a way to put Botox next to the nose to reduce the gummy smile a little bit. And these are all options to be discussed with the patients. We're not trying to make one person look like another. Each person has to retain their individuality and their own personal beauty. And that's really, really important to us. Thanks for listening.